we need to figure out the rest of the story. We've talked about MSI tumors and how those tumors, IO works for some of those patients, but we really have not moved the bar in microsatellite stable colon cancers, which remember is the majority of cancers. I've gone around and talked to docs around the country, and they actually say, I'm yet to find an MSI colon cancer. So they really want, and the patients really want, some better answer around microsatellite stable colon cancers. And the punchline here is that we really haven't. Did a big randomized clinical trial, turned out, based on some early phase 1/2 data, didn't pan out. The combination therapy didn't improve things over standard of care. One of the approaches that's moving things forward is using sort of vaccine type approaches in combination with IO. It's possible that IO just won't work in these patient populations. We have to remember what IO is. It's basically allowing an already angry immune system to finish the job that it started. It removes a blockade. And so if the tumor itself is not pissing off the immune system in some way, then in fact IO won't do anything, the current IO therapies that we think about. So a lot of the work that's going on now is trying to stimulate the immune system and then using the checkpoint inhibitors to keep any resistance from forming. And we are all hopeful that that kind of combination approach will in fact change outcomes for microsatellite stable colon cancer. Everyone is trying anything in the immuno-oncology space. There are a lot of these drugs out there. I think 5 approved drugs out there on the market right now. And you can Google and find almost any paper to support drug A plus drug B plus IO. And so there are an enormous number of clinical trials going on out there. And honestly, I think that's good because we don't really understand how these things might interact. In fact, on some level, we tripped over the checkpoint inhibitors themselves. And so exploring this is smart. And one of the ways this is being explored is taking traditional colon cancer therapies and combining them with IO in the microsatellite stable patient population to see if there's any renewed or improved outcomes. And so the combination of cetuximab and pembrolizumab makes total sense just to try it. The phase 1 studies showed some early promising activity, but this does not mean, and this is really an important point, that docs out there who are desperate to try anything, and patients who are desperate to try anything, should just throw these drugs out there based on these early clinical trials at their patients. Because I do think the toxicities, the cost, and the potential negative impact really is out there as well. So this is not giving you permission to throw a Hail Mary of combining it. Wait for the data to mature to see if there's indeed true benefit between the combination.